Doctor, have you seen cases of COVID in children here in southern Arizona?
Yes, we have.
Can you tell us a bit about these cases and how serious they've been?
Yeah, in general, children tend to have mild illness, although unfortunately that's not always the case. They can get quite sick, but typically when children do get COVID and get symptoms from it, they present very much like a typical cold, fevers, oftentimes some mild runny nose, cough. They may actually, particularly in children, seems that they may actually present more with GI symptoms, so diarrhea, nausea, a little bit of vomiting. But in general, fortunately, our kids have not been particularly sick when they do get it.
There's this idea that the virus is not affecting children the same as it does adults. Is that true, or is it because children don't have pre-existing conditions yet? Can you help set the record straight?
I think we don't exactly know the full reason why that is, although it does seem to be true that children don't seem to get the disease as frequently as adults can, meaning not that they're going to get it more than once or twice, but that the frequency at which the children get infected seems to be less than adults. I think it's probably multifactorial. The things that you mentioned, the comorbidities, the being having heart disease, having lung disease, being overweight, all of those things, we tend to see less in children. So it's certainly possible that that's contributing to less illness with them. But there's also theories that children are exposed to a lot more viruses and they may have some cross-reactive protection from some of the other coronaviruses that they've gotten in the past. We don't exactly know why it is yet.
What should a parent do if they suspect their child may have the virus?
I think that the largest treatment for that really is supportive care. If the child who has it is doing well, and they had just a mild fever, a mild cough, the best thing we can really do probably is stay home, keep them isolated away from others to try to minimize spread of the disease to somebody who may not do as well with it. And if your child is getting sicker and you're at all concerned, then certainly visiting your pediatrician or coming to an emergency room or urgent care would be very appropriate.
How do we keep kids safe? I mean, the flu season is underway or will be here very soon. And there are things like proper hygiene and good rest. But I mean, there's got to be more we can be doing as parents.
That's difficult. I think that really the thing that we can do, the number one thing we can do to protect our children is follow the rules that we would follow for ourselves. We can try to avoid groups. We can social distance. We can wear masks. We can wash our hands. Wearing eye protection if you're in a setting where you can't necessarily stay back as far. All those things that we would do for ourselves to try to keep ourselves safe are exactly the right thing to do for our children.
As schools begin to reopen their doors to children, are you hopeful that we are taking the right steps in as we venture into the unknown?
I think we are. I think that there probably is going to be a right way to do it. And the way that we're proceeding, the way our schools are proceeding in our community, very slow, very cautious, I think is exactly the right way. There are certainly a whole set of other dangers to keeping children out of school. And so getting children back into the school setting is ultimately probably a good thing, but certainly we wouldn't want to take shortcuts and increase the risk. But the slow, cautious approach, watching schools, if there are outbreaks, being able to react to those quickly, I think as long as we're doing those things, that's going to be the right approach.
Okay, Dr. Chan Lowe from Banner University Medicine. Thank you for your time.
My pleasure. Thank you.